Hello, how are you? This is Dr. Earle again. Let's talk a little more about the impact of food and nutrition on mental illness. Major depression. Major depression is a disorder that presents with symptoms such as decreased mood, increased sadness, decreased mood, I'm sorry, increased sadness and anxiety, a loss of appetite, and a loss of interest in pleasurable activities, to name a few. If this disorder is not properly treated, it can become disabling or fatal. Patients who are suffering from major depression have a high risk for committing suicide, so they are usually treated with psychotherapy and/or antidepressants. Depression has for some time now been known to be associated with deficiencies in neurotransmitters such as serotonin, dopamine, neuroadrenaline, and GABA. As reported in several studies, the amino acids are often helpful in treating many mood disorders, including depression, since the consumption of omega-3 fatty acids from fish and other sources has declined in most populations. The incidence of major depression has what? Increased. Now, giving someone vitamin B1 at bedtime led to rapid recovery from major depression in less than 7 days for most of the patients in a study. Let's look at bipolar disorder. A patient suffering from major depression may also present symptoms such as recurring episodes of debilitating depression, uncontrollable mania, hypomania, or a mixed state, that is mixed with manic depression, with manic mania, that is being real hyper and full of energy, and depressive episodes. So sometimes people that have bipolar disorder can fluctuate between these two. They can have a run of mania and then followed by a run of depression. So when that happens, an individual is generally diagnosed with bipolar disorder. Some biochemical abnormalities in people with bipolar disorder include oversensitivity to acetylchlorine, excess vanadin, vitamin B deficiencies, taurine deficiencies, anemia, omega-3 fatty acid deficiencies, and vitamin C deficiency. However, vitamin C has been shown to protect the body from damages caused by excess vanadin. A single 3-gram dose of vitamin C decreases manic symptoms in comparison to a placebo study that was done. Taurine is an amino acid eliciting a calming effect. A deficiency in this amino acid may increase a bipolar patient's manic episodes. In addition, 80% of bipolar sufferers have some vitamin B deficiencies, often accompanied by anemia. The combination of essential vitamin supplements with the body's natural supply of lithium reduces depressive and manic symptoms of patients suffering from bipolar disorder. Now, I know that up to this point, I have been mostly focused or entirely focused on mood disorders, like depression and bipolar disorder. But now I want to mention a couple of other mental health issues that can also be helped with proper nutrition. Let's look at schizophrenia. Schizophrenia is a mental disorder that disrupts a person's normal perception of reality. Schizophrenic patients usually suffer from hallucinations, paranoia, delusions, and speech and thinking impairments. These symptoms are typically presented during adolescence. Disturbances in amino acid metabolism have been implicated in the pathophysiology of schizophrenia. Specifically, an impaired synthesis of serotonin in the central nervous system has been found in schizophrenic patients. High doses, that is 30 grams, of glycine have been shown to reduce more subtle symptoms of schizophrenia, such as social withdrawal emotional flatness, and apathy, which do not respond to most of the existing medications. An open-label clinical trial performed in 1996 revealed that 60 grams of glycerin, that's Glycine, per day, could be given to schizophrenic patients without producing adverse side effects, and that this dose led to a twofold increase in cerebral spinal fluid, or CSF, glycine levels. The most consistent correlation found in one study that involved the ecological analysis of schizophrenia and diet concluded that increased consumption of refined sugar results in an overall decreased state of mind for schizophrenic patients, as measured by both the number of days spent in the hospital and poor social functioning. That study also concluded that dietary predictors of the outcome of schizophrenia and prevalence of depression are similar to those that predict illnesses such as coronary heart disease and diabetes. A Danish study showed that better prognosis for schizophrenic patients strongly correlate with living in a country where there's a high consumption of omega-3 fatty acids. Omega-3 fish oils have been shown to help depressive patients and can also be used to treat schizophrenia. Furthermore, studies suggest that supplements such as commercially available MEG-EPA, that's VEG-EPA, capsule, when taken on a daily basis, helps healthy individuals and schizophrenic patients maintain a balanced mood and improved blood circulation. The VEG-EPA capsule contains 280 milligrams of EPA from marine omega-3 fish oil, 100 milligrams of organic virgin evening primrose omega-6 oil, 1 milligram of the antioxidant vitamin E, an outer capsule made out of fish gelatin for schizophrenic patients. DHA supplements inhibit the effect of EPA supplements, so it is recommended that the patient only take the EPA supplement, which the body will convert into the amount of DHA it needs. Approximately 2 grams of EPA taken daily in addition with one's existing medication effectively decreases symptoms in schizophrenic patients. Let's look at another disorder, obsessive-compulsive disorder. Obsessive-compulsive disorder, or OCD, is an anxiety disorder that causes recurring stressful thoughts or obsessions that are followed by compulsions, which are repeated in an uncontrollable manner as a means of repressing the stressful thought. It is well documented that selective serotonin reuptake inhibitors, or SSRIs, that's selective serotonin reuptake inhibitors, help patients with OCD. Therefore, it is clear that nutrients which increase serotonin levels will reduce the symptoms of OCD. As discussed earlier, the amino acid tryptophan is a precursor to serotonin, and tryptophan supplements will increase serotonin levels and treat OCD. A commonly available supplement called Amarin has recently proven to help patients suffering from depression, anxiety, and OCD, obsessive-compulsive disorder. The main ingredient in Amarin is in St. John's wort and has been shown to help OCD patients better deal with their recurring thoughts and compulsions. 2 double-blind placebo-controlled studies were recently performed that compared the effects of a 900 milligram daily dose of St. John's wort extract to 20 milligram daily doses of Paxil. Paxil is a psychotropic medication that you get from a psychiatrist, which are both SSRIs used to treat OCD. In comparison to patients taking Paxil, those who took the St. John's wort supplement showed a 57% decrease in OCD symptoms and were 47% less likely to exhibit side effects. In comparison to patients taking afloxetine, consumption of the St. John's wort extract reduced 48% of OCD patients' symptoms. These results clearly depict how the use of nutritional supplements can be effective treatments for mental disorders. I hope that helps you. You know, I know that all of what I'm saying is somewhat complicated, you know, but it's kind of based on my notion that you don't have to go to drugs as the first treatment for a mental illness. You don't have to. You can, but you don't have to. And I certainly have nothing against drugs. All I'm saying is use drugs as the last resort. Thank you very much. Have a wonderful day.